How about nicotine? What does it affect mostly that would concern us, besides the obvious, okay? But in the short term, somebody comes in and they're just, you've seen this. If you've got an office, you can see the parking lot that feeds your office. They're getting the last drag off that last butt before they come in, and then of course they always wait and then blow it in your office, right? But what's that doing to their microcirculation? You gonna push them right into traction then? What about diabetes, small vessel disease? Mostly, we always think about the sugar, but isn't it a small vessel disease too? So are we going to be able to traction duration and intensity the same with a borderline diabetic as we can with someone else? And is this history clinically relevant then? What about mood elevators? How many of you have these people that come in the morning and they're pumped up, especially around here where you can get really good coffee? Dr. Onken turned me on to the Americano, right? A little foam milk on top. But what if they're jacked up for some other reason? And then they come in the evening and they're just down in the dumps. We know that these mood fluctuations, right, relate to some of the nasty stuff that people are taking. I've read estimates, you guys are probably more up on this than me, that somewhere around 40% of the population is now medicated in some way, shape, or form with mood-elevating drugs. Is that true? Scary. Do we need to be mindful of this? And what if they're a little irrational? Gee, I wonder why. Anybody ever had a cokehead? Somebody who's taken in heroin? Heroin patients are actually pretty good. They're very docile as long as they're taking heroin. No, I'm absolutely serious. I had a bunch of addicts from Vietnam era that were total upstanding citizens. It's like, yeah, they're having a cocktail. Statin drugs. Our medical counterparts still haven't really grasped that somebody coming in with chronic multiple area joint pain doesn't always have to be fibromyalgia. How about excessive booze? What about Friday appointments when Thursday is the big night out? Do you push them as hard? I want you to think this way more. Chronic insomnia, sleep apnea is a big deal now. What if somebody is, when I was flying across here, the last leg going over the beautiful mountains we were on oxygen. The pilot has to be on oxygen over 12,500 feet, right? Now, my beloved cameraman, Alex, is a passenger. He doesn't have to have oxygen. And to make his life very simple and get him restful, we had him have a nice hamburger for lunch and then no oxygen. And so Alex went night-night. If your perfusion is, 80%, you're going to sleep. Well, what if this person has sleep apnea? And they're coming in constantly tired and, all right, got to get to 20 minutes today. Or, got to get your exercises. Are they really getting the benefit? How about deconditioning? Nobody's out of shape. What about collagen vascular diseases? Somebody has psoriasis, somebody has RA, somebody has periarteritis nodosa. All of those things, right? Sometimes they forget to tell you that stuff. You got to dig in and look and observe, please. Immunosuppressive meds. I had a case recently, I didn't have a case, but I had a client with a case where it was a young woman who'd gone through a mastectomy and a reconstruction, but had like 3 or 4 rather lengthy bouts with chemotherapy also. The woman looked great, but yet had pretty severe issues with recovery. And about 3 or 4 weeks into care, just imploded. I just can't do this anymore. Well, apply the same set of circumstances to everyone. Can't. So be mindful of this. What about physical training? How many of you work with triathletes? Or I know some of you are cycling coaches and do serious training and such. We could step back from that and say, yeah, it's a great challenge and it's great to be fit, but Julia Child lived to be 92 and James Beard lived to be like 88, and I think Jim Fix didn't live very long, and some of the other people. So, balance is important here. So if somebody's just killing themselves training, you got to know that. And how are they going to be able to train if they're doing 3 hours of heavy training? I mean, you two are pretty serious athletes. If you're doing 3 hours a day or 5 hours a day of serious training, can you really do traction and some of these other things at the same level? Maybe not. Maybe your recuperative ability wouldn't sustain it. When you've got all this data together, I really want to see you summarize it. I like the idea of a worksheet type thing. You could certainly skip this process and use a yellow legal pad. I really don't care. But you want to review this. What were their concerns? I don't want x-rays. But you got past that. You better address it in the presentation of findings. I'm concerned about money. I'm concerned about time. I'm concerned about, getting my neck adjusted or manipulated or popped. I'm concerned, right? I don't know if I'm in the right place. Whatever their concerns are, you better put those on a piece of paper and review them before your presentation of findings. What's their chief complaint? Summarize it in a sentence or two. What effects do their chief complaint actually have on their activities of daily living? What can they and can't they do? Is this valid documentary evidence? Yes. Is it also important in developing the relationship? Yes. Objective factors and complicating factors. Overweight by 50 pounds, pre-diabetic, taking meds, smoker, all those things. What were the first impressions that the doctor and the team had, or team and doctor had of this individual? Yeah, this is going to be a great patient. Often they are. What were those first impressions? I don't care. They should be on here. They're some of the most valuable information you can have. What reasonable and legitimate options are available to them? What if they're all beat up, gnarly, arthritic, totally beat up? Can they go through a structural rebuilding program? Maybe not. Okay, we'll talk about that later. What's your working diagnosis? And did you complete a sheet? There's a sample of that. What's the x-ray report you're doing? Every film that's taken should have one. Any need for a second opinion? How about referring the films out? Any additional notes or observations? Now you're ready, perhaps, to get ready to do a presentation of findings. Okay? All right. Any questions? Wonderful. Let's take a break. And after the break, we'll have Dr. Denise Perrone from Posture Co. Thanks.